Welcome to my work, the world of the medical laboratory scientist. Health is wealth, knowledge is power. Hearing loss, metabolic syndrome, and medication. When we talk of hearing loss, that is very easily understandable that one could use the sense of hearing whatever is being said. That is the sense of sound. But what I'm trying to do in this presentation is hearing loss as a result of the metabolic syndrome that the person has, or even the medication that you are now using causing that hearing loss. Research has shown that there is that strong relationship between hearing loss and metabolic syndrome, as well as even some medication. But the causal relationship has not been well established, and that is where it is still a thing that is not overly reported. But among the complications that you have from metabolic syndrome, one, we know that it could cause future heart attack, future problem, because this metabolic syndrome has to do with 5 variables. That is, you are talking of the fasting blood sugar being high. You are also talking of your triglyceride, high triglyceride, low high density lipoprotein cholesterol. You are also talking of high hypertension when the person is hypertensive, and you want to talk about the central obesity, when you are talking of visceral obesity. These factors that are so listed, at least 3 out of it becomes a case, what you now call a metabolic syndrome situation or condition of that patient. And with that kind of situation, most of the complication, early death and what have you, you find it really happening to people who have this kind of presentations. The problem is so large because we are now living to older age. People generally, you find in a civilized country, that is, countries that have the wherewithal to provide for good health, the people live to old age. But this is now becoming, metabolic syndrome is now becoming the real problem, predisposing to things that hence their life early, and also cause these chronic conditions, incapacitating them sort of, and that is not what we want to experience at old age. The problem associated with these metabolic syndromes are many, and I shall be listing it in the slide session. What's the role of the medical laboratory scientist? I think I don't need to over balloon it. You cannot talk of a high fasting blood sugar without talking about the medical laboratory scientist, or high triglyceride, or low HDL. All these are parameters that are being checked in the laboratory. The medication too, how do you now associate the medication with hearing loss? The laboratory tests you could do will also be exposed in the slide session, so that we can have a deeper understanding of this hearing loss problem associated with metabolic syndrome and also with medication. The more we watch more of my slide, the better you have more understanding on your health condition. So let's move gradually into the slide session, where I shall expose more deep knowledge on hearing loss problem associated with metabolic syndrome and also with medication. The outline: objective introduction, mechanism, laboratory diagnosis, prevention, and medication. The objective: to create more awareness of the strong relationship between loss of hearing and metabolic syndrome, as well as its medication. Its early laboratory diagnosis for proactive effective treatment and or prevention. The introduction. Metabolic syndrome is a cluster of conditions that occur together, increasing the risk of heart disease, stroke, and type 2 diabetes. These conditions include increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride level. It is increasingly common, and up to one-third of the U.S. adults have it. The prevalence of metabolic syndrome using the NCEP and ATP criteria varies from 16% of black men to 37% of Hispanic women. The prevalence of metabolic syndrome increases with age and increasing body weight. Because the US population is aging and because more than one half of adults are overweight or obese, it has been estimated that metabolic syndrome soon will overtake cigarette smoking as the primary risk factor for cardiovascular disease. Metabolic syndrome is an even stronger predictor of risk for type 2 diabetes. The prevalence of hearing loss is great. It affects millions. 1 in 8 people in the US aged between 12 years or older has hearing loss in both ears based on standard hearing examination. So you can then understand that this is an established fact. So it's very difficult to really pinpoint it, except one does a very strong research that shows the odd ratio as high as 4 point or more than that, and then the causal relationship, if it's going to be established, we'll have to take into cognizance the confidence interval and significance of the test. About 28.8 million US adults could benefit from using the hearing aid. Well, that is also important to note. Men are almost twice as likely as women to have hearing loss among adults aged 20 to 69. That's the area where we are concerned with, especially because it is around that area, that age bracket, that metabolic syndrome is prevalent. Now, let's study the mechanism of how this metabolic syndrome affects hearing loss. Metabolic syndrome significantly increases the risk of sensory neural hearing loss, primarily driven by high blood glucose, high blood pressure, and central obesity. People with these combined health conditions face a higher chance of inner ear damage and poorer recovery from sudden hearing loss. High blood pressure and narrow arteries reduce tiny blood vessels capillary flow in the inner ear, thereby starving the cochlea and inner ear cells of vital oxygens and nutrients, which leads to permanent cell damage. High blood sugar creates harmful chemical changes. We are talking of oxidative stress and swelling, inflammation in that area that destroy delicate sensory structures in the ear. The laboratory diagnosis. Blood tests are usually used for both hearing loss and the majority of these metabolic syndrome biomarkers. Talking about fasting blood glucose. If you want to get high value, the laboratory is where you can go to high triglyceride and low HDL. The same thing for ear loss. Biomarkers for hearing loss include inner ear specific proteins, which are measured in the lab, like you do autolim-1, a glycoprotein produced in the inner ear that can be detected in blood serum, studied as a marker for inner ear dysfunction. Prestin 2 is another protein that can also be tested. Then you have inflammatory markers that you can use. CR protein, a marker, the neutrophil to lymphocyte ratio is another way to confirm that there is this inflammatory response as a result of the metabolic syndrome. Yes, the key point to show this strong relationship between metabolic syndrome and even the medication used to treat is here presented. A study showed Metabolic syndrome linked to hearing loss. Meta-analysis where the odd ratio was 4.22 for prevalent hearing loss. Diabetes-related risk increase with longer duration, poor glycemic control, and hypertension. Hyperglycemia may damage cochlear microvasculature, stir vascularis involvement likely. Several metabolic drugs are associated with ototoxicity when you are talking of ear toxicity. Low diuretic, statin, commonly used for cholesterol, and some antihypertensives. PCP should screen hearing every 1 to 2 years. Ask about tinnitus, that is when you hear different sound in your ear. There are common drugs that really present with it. Even antibiotics, something like streptomycin has been implicated anyway. Communications difficulty and daily function. Finally, prevention and medication. Metabolic syndrome can be prevented or reversed by making lifestyle changes, which includes losing weight, exercising regularly, eating a healthy, balanced diet to keep your blood pressure, cholesterol, and blood sugar level under control, stopping smoking, cutting down on alcohol, use your prescription drug regularly to control your blood pressure, diabetes, obesity, cholesterol level. This will all help to maintain a healthy lifestyle. Healthy eating plans is also highly recommended if you want to maintain, apart from the regular physical exercises. That eating plan includes such as the dietary approach to stop hypertension and the Mediterranean diet emphasis on the vegetables, fruits, whole grains with high fiber and lean protein. Sugar sweetened drinks, alcohol, salt, sugar, and fat, especially saturated and trans fat, are all suggested. That is more or less to reduce or avoid them in healthy eating program. So especially the calories is what you must take note of, because once the calories is too high, it goes to store and create that obesity, the central obesity that is not good for one's health, and this pile up to become to let one become diabetic and even affects the heart. So this is where this ends, and I hope you check more videos to get more satisfaction from the presentation. Subscribe so that more effort will come from me to you.